Hi, this is Wendy Ayers, SEPS 750, Dr. Watson. As part of my simulation, the participants are required to state the indications for pulmonary function testing. I am going to do that part of the simulation and by recording this video. So I'm going to list the indications or the primary indications for pulmonary function testing, and I will explain a little about why that would be an indication for pulmonary function testing. Well, one would be with routine physical exams. One of the things that it would be important to do this is with patients having a routine physical exam and they have a smoking history, or for some reason their job was related to some form of pulmonary disease, sort of like if you worked with asbestos and you did not wear the proper gear, or you're a sandblaster, or you're a farmer, because farmers get exposed to mold from haze and stuff. So those would be indications for doing pulmonary function testing with a routine physical. Another one may be for work physicals. Again, this would be with people that part of their work is they have to wear a respirator or some form of a mask. We also do preoperative pulmonary function testing, and this would really mainly be for patients that are having abdominal and thoracic surgeries, and especially if they have some form of pulmonary disease or pulmonary history, smokers, that are patients with restrictive diseases. We would want to know prior to them having surgery uh, how severe is their lung disease, how much has it affected the function of their lungs. It gives us a really good idea if we do it pre-op so that we can treat them properly after surgery. And then the other would be to assist in diagnosing lung diseases such as asthma, emphysema, chronic bronchitis, pulmonary fibrosis. Another reason would be to determine the extent of their lung disease, so we can sort of grade the extent of their lung disease. Another one would be pre and post bronchodilator testing. We would do a pre bronchodilator spirometry testing, then we would give them a bronchodilator, and then we would do post bronchodilator spirometry. And the reason we would do that is that we actually can gauge that in a percentage of improvement in lung function with post bronchodilator compared to pre bronchodilator. And this would give us an indication of the reversibility of their bronchoconstrictions. The other thing would be if the patient was having side effects to some forms of medication. Some forms of medications do affect the pulmonary system, so they would be a candidate for pulmonary function testing to see if the medication that they're on has caused any form of lung disease. Those are the main indications for pulmonary function testing. Thank you.